Welcome back to the Ed Morrissey Show podcast. We're going to talk about healthcare policy with Dean Clancy of Americans for Prosperity. And Dean, actually, I'm a little mystified. Didn't we solve all this in was it 2010 when we passed Obamacare? Didn't we enter the utopia of Obamacare at that point?
Well, I hate to tell you, Ed, the Affordable Care Act wasn't. Yeah. No, insurance premiums have doubled since then. You know, the cost of insurance, the amount you have to pay out of pocket before your insurance kicks in has tripled, and your ability to see a doctor is shrinking, all because of the reform. So
Right.
let's, any more victories like that and we're undone.
Yeah, there's a line from the movie Matewan. I don't know if you ever saw it. It's a John Sayles movie, really good one too, about the Cold Wars in West Virginia in the 1920s. And this guy says, hey, the union organizer up there, he says, all I wanted to do was help you people. He says, Mister, we've been having people come up and help us all our lives. The federal government came up here to help us. The mining companies came up here to help us. Now you've come up here to help us. We've had just about all the help we can say. It's a great line. It's a really good movie too. It's not a funny movie. John Sayles makes some pretty good movies. But but it reminds me of this, right? Is that there's this impulse to meddle from the top down, and this is really the entire problem with Obamacare. And there were people like Americans for Prosperity, and myself and other people who were arguing at the time that they were actually going the wrong direction. If you wanted to reform the system, what you actually needed to do was get third-party payers out of the system and restore proper price signaling, so that doctors could actually offer things at a fair price and people would be able to negotiate that right up front. And there were ways to do that by, converting a lot of this, the federal subsidies out of, for the insurance as direct tax credits back to people who could use them to apply them to medical care, HSAs and all that. So your proposal, and you had this in the Washington Examiner, sounded very familiar to me. I'm reading through this and going, and I'm not sure if it still works, right? Because we kind of have a completely different system or completely different set of opportunities. Is there still room for that type of free market approach for actual health care reform?
Yes, you're right that it gets harder and harder to fix the system. One thing that's happened since 2010 that has a silver lining to it is that people on our side of the debate failed to repeal Obamacare and replace it. We should have done that, and Americans for Prosperity was very much in the forefront of leading efforts to do that, but it didn't happen. 2017 was the reform window of opportunity for market-oriented health reformers, and we just didn't get it done. And I think a main reason that happened was because all along, from the beginning, the American people were of two minds. They didn't like Obamacare. They felt it was kind of forced down their throat, and it had an individual mandate and new taxes and all kinds of mandates, and obviously lots of controversy, purely partisan. It passed on purely partisan lines. It was a very unpleasant thing. But on the other hand, they were never really wild about just repealing it. They wanted to fix it. That's what the polls showed consistently. So repeal and replace ran up against the fact that the Americans were like, look, we don't like it, but don't repeal it, just fix it. And my feeling is now that we have in effect achieved universal coverage in this country, not so much because of the Affordable Care Act, although with help from it. We actually, in some sense, already had it before Obamacare. But right now, in the wake of it, we've got 98% of Americans either enrolled in or eligible for a generously subsidized health insurance plan of some kind. That includes workplace plans. So we've got universal coverage. The issue now is affordability. and the ability to access a doctor and so on. And you can reform the system to give people more affordability and more access. And you can do it without having to repeal any of the existing government subsidies and well, you have to repeal some of the mandates, and we can talk about specific ones. But you can do it. You can bring down the price, you can increase competition, and move towards a system in which doctor and patient basically deal directly with each other, and you don't have the third parties meddling, like you said. And those third parties are insurance companies, government bureaucracies, sometimes employers, drug makers, and others. Let's get those third parties out as much as possible. And yes, it is possible to do it.
It's interesting too, because this was, again, part of what we were arguing, which is that this Obamacare was a one-size-fits-all approach to healthcare. And I think that part of what you're proposing here is something that we've said all along, which is that by and large, younger Americans really don't need that type of comprehensive, HMO, PPO sort of approach to healthcare, because they don't utilize it often enough to justify the cost of carrying that kind of insurance. The utilization for people in that age range is really remarkably low. And so this was the explicitly part of Obamacare. You had to mandate that those people participated in the system so that you could cover the costs that were associated with utilization for older Americans, people like me. So all of you 25-year-olds, thank you very much for paying for part of my subsidies, but it's not necessary. And it was based on the idea that that was the only way that you could pursue the kind of price reductions that would actually lead to lowering costs. And as you pointed out, we've had 13 years of this now. 13 years, 10 years, 10 years active, right? Because 10 years is when the portal went online and all this kind of stuff. But I mean, the mandates were in place before that. And it's clearly not working. And yet, Dean, nobody's coming. I mean, Americans for Prosperity has a plan. I could rattle off a plan. But politically speaking, the Republicans don't want to do it. The Democrats sure don't want to do it. There is no plan. There is no alternative. And that was what we saw in 2017, too, is that Republicans spent 7 years griping about this thing. And then when it got to the point where they could do something about it, they didn't have a plan. And the reason why is because you're going to have to tell some people no. And nobody wanted to do it.
Well, what happened in 2017 was Republicans got in with a promise, repeal and replace. They didn't have consensus on a replacement, and that's where it broke down. And Donald Trump, made big promises about it's going to be a big, beautiful plan, but he didn't do what you need to do to get people to come together and agree on a consensus replacement plan. It could have happened, but it failed to happen. And by the way, you're right that young people have to pay too much under the current mandates and structure. And as a result, most of the uninsured, there are technically still 30 million uninsured people in this country. Most of them are eligible for some kind of subsidy, but they don't bother to sign up because in reality, it's really not affordable. And that's especially true for young people because the prices have been driven up more than for anybody else, for them. So, all of this, we still have to fix it all, but I do want to challenge you a little bit when you say there is no plan. There is a plan, and I think we should talk about it. But first, the more important question is there an appetite? Does the public want to fix healthcare? And our polling at AFP shows that yes, we are approaching a point where people are demanding action. We've found that 71% of people right now say that healthcare is either in a state of crisis or has very serious problems. Now, 75% of people will also say, don't disrupt what I currently have. Whatever I have, I may not be entirely happy, but I don't want you to mess with it because people are afraid of change in healthcare. So those two impulses are going on at the same time. The top three issues on voters' minds right now are inflation, jobs, and the high cost of healthcare. 41% of Americans say healthcare costs are a crisis. The last two times in our polling when it crossed 40%, to call it a crisis, was right before Obamacare and right before Hillary Care, those big national debates about reform. The cost of care is faster. It's going faster than inflation, and it's not letting up. And so people are, I think, if they may not realize it now in 2023, but I think by next year, by 2025, they're going to be demanding relief. And so we're going to end up having to change what's been done. We're going to have to undo the dumb things we've done. We can keep some of the existing things, like protecting people with pre-existing conditions. We can keep that. The thing about letting 26-year-olds be on their parents' insurance, I think it's a dumb policy. It raises everyone's premiums, but we can leave that in place. And those are very popular mandates. But there are other mandates that just drive up the cost of insurance needlessly. And we can get rid of those, and we can create a new subsidy, a tax credit, or basically a lump sum voucher for people that will help fill in the cracks, and it will be portable between jobs, and it will be, whatever you don't spend, you get to save in a tax-free health savings account. What I'm describing here is a reform plan that is actually introduced legislation, and AFP is working hard to build support for it. And I'd love to talk about it more if we've got time.
Absolutely. We've still got a few minutes. Lay it on me. That's what we want to know about. Absolutely.
Yeah, the plan is called the Healthcare Fairness for All Act. It was drafted and introduced by Congressman Pete Sessions of Texas. He introduced it on May 9th, and it was written with some input from outside health experts, including AFP, and it does what needs to be done to fix what's broken in America's healthcare system while preserving what works. And that's what voters tell us they want. Just fix what's broken. One of the things they want is more affordable coverage, and coverage they can take from job to job rather than losing their healthcare when they change jobs. This bill would make that happen through those lump sum vouchers that I mentioned. They're very generous, by the way. It's $4,000 for each adult in your family and $2,000 for each dependent child. So if you're a family of 4 with 2 adults, that's $12,000 you can spend on health insurance or health out-of-pocket expenses. Whatever you don't spend, you can save in a tax-free health savings account, and everyone would have access to that tool, which is not true today. Today, only about 1 in 10 Americans, as a practical matter, can access a tax-free health savings account. We want to make it HSAs for all, and Congressman Sessions' bill would do that. The bill also removes a number of barriers between patients and their doctors. It increases competition. Some of it's wonky, like site-neutral payment in Medicare, or ending the ban on physician-owned hospitals. Yes, there is such a ban in federal law. Do you think bankers should be able to own a bank, or hairstylists should be able to own a salon? Well, physicians cannot own a hospital, thanks to federal mandates that make no sense. So we would repeal those. And in general, what would happen is we would shift choice and control to the patient, away from third parties like insurance companies and the government. But we wouldn't take away anything anyone currently, is comfortable with. So if you want to just stay with what you've got, you can do that. If you like your health plan, you can keep your health plan. That'll actually a true promise in the Healthcare Fairness for All Act. And it wouldn't break the bank budgetarily either, because the reforms of Medicare and so on, which basically just cut out waste without reducing anybody's benefits, would help pay for the new subsidies. And of course, you would have to choose between subsidies. So if you use the new lump sum voucher, then you couldn't use one of the other existing subsidies. So it's basically a fiscally responsible, free market approach to fixing what's broken in healthcare. We're very excited about it, and we're trying to build support for it. It's the Healthcare Fairness for All Act.
Healthcare Fairness for All Act. I'm assuming at Americans for Prosperity, you can find out more there as well. Is the website still afp.org? Am I correct on that? Or is it americansforprosperity.org?
That's right, the latter, americansforprosperity.org. We also have a special healthcare-focused website that I'd love to mention. It's called personaloption.org. personaloption.com. The reason for that name is our whole vision about reforming healthcare, we call a personal option, as opposed to the so-called public option or a government option, Medicare for all.
Yeah.
Those government-centric reforms can't deliver the things that Americans want. They only give us what we got now, which is higher prices, longer wait times, more hassle and paperwork. And a personal option would fix all that.
Well, the personal option, again, Pete Sessions is actually my congressman, so it's good to know that he's working on that. Personaloption.com or americansforprosperity.org, either one of those two will work. And we got a minute or two left. I just want to tell you how much I appreciate Americans for Prosperity. I haven't had a chance to engage too much with AFP of late, mostly because I'm not traveling much to events, that sort of thing. But they've always done a really great job in being on the ground and talking with people to understand what it is that they want and how it is that they can, prosper. And they do classes in cities, or at least they used to. I'm not sure if that's still a thing. I hope it is, to get people to understand how to apply common business and capitalist principles in order to make themselves prosper, especially in so-called economic zones where we're really trying to regenerate economies. And I don't think that people pay enough attention to AFP for those sorts of efforts either. So when you see things like the personal option, HFFA, that really is coming from that sort of grassroots connection to what you're talking to actual people on the ground and finding out what it is. It's not, you're not just getting a poll and running with the numbers here.
Yeah, no, Ralph, thank you very much. That's true. AFP is a national grassroots advocacy organization. We got thousands of volunteers across the country and hundreds of paid staff in 37 states. And we believe that good policy goes to those who show up. So we try to enlist people, engage them, educate them, learn from them, and try to make the world a better place. And our idea of a better place is a world where you can live your version of the American dream. We're trying to reignite the American dream, mostly by removing barriers between you and your version thereof. And you're right, we knock on doors and we educate and we do all kinds of stuff. And this call is just one part of that. And thank you for all that you're doing to help educate folks about reality versus the matrix.
Well, Dean Clancy, thank you so much for joining us today. It's great to talk to you about reality as well as the Matrix. I mean, we can talk about either one of those two things anytime, Dean.
Well, thank you. It was my pleasure.
All right, folks. Don't forget americansforprosperity.org or personalchoice.com.
Personal option.
Personaloption.com. Thanks, Dean. See, this is the reason why I make sure you're still on the line while I do this. Personaloption.com or americansforprosperity.org. Thanks again, Dean, and great talking with you.